I'm Mark Jackson. I am the Director of Business Intelligence for Piedmont Healthcare in Atlanta, Georgia. Prior to that, I spent a couple years as our Project Management Office Manager and the Manager of Business Development. But today, I get the honor of being the Director over a set of developers who produce amazing dashboards and self-service infrastructure that help our practitioners and our administrators produce quality dashboards and improve patient care. So Piedmont Healthcare is a 7-hospital system in the Atlanta area, and we have over 100 physician practice offices. We're an integrated healthcare system, and we've served, I think, 2 million people last year, so we've touched a lot of patient lives and had approximately 250,000 emergency room visits, so we're a very busy healthcare system. When it comes to the challenges that we face, definitely speed to insight is one of the bigger ones. Especially in healthcare, I believe it's really important that we make that feedback loop as fast as possible. So if there are issues with the way that we're treating patients or throughput in our operating rooms, we can let our practitioners and our administrators know, near real time that there's something wrong and something that could be corrected so that we improve that patient experience. The second thing I would say is scalability. So that's a huge challenge in healthcare. When we've implemented our electronic healthcare record system across all of our hospitals and our physician practices, it produces an enormous amount of data. So scalability is important, especially as Piedmont grows and we add new hospitals. We've got to be able to process the abundance of data. And today, we have single tables that are 1.6 billion records tall. And then we have model data sources that are really over 1 trillion records. So huge amount of complexity. And I would say, in relation to other industries, I think our complexity is probably much higher, even though we have a lower number of transactions than other industries would have. And then lastly, the challenge of just security. Healthcare data is highly regulated, is very sensitive, so we have to make sure the right people have access at the right time to be able to do things to improve our patients' experience. Exasol is intended to be the backbone of everything that we do at Piedmont. And today you can find things like patient satisfaction survey information. You can find employee turnover information, so we know how that's going from an internal perspective. But then also, and I think more importantly to our mission, it's to make sure that patients are receiving quality care. So we're monitoring readmissions for our patients. We're monitoring infections that are coming into the hospital system to make sure that patients are being treated effectively. Exasol checked all the boxes for me. It enabled us to scale beyond what we're able to do with just pure Tableau extracts, beyond what we're able to do with live connections to other databases. And I looked at many other analytics database vendors, had my hands on with some of them, read lots of posts about others, and just realized Exasol just works. It does everything that we need it to do, and it doesn't hiccup. It just continues to function, and it delivers on everything we ask it to do. Well, thanks to the abundance of data that we now have from our electronic medical record system, healthcare is rapidly changing as a result of all of the insights that we're able to derive from that information. So it's a really exciting space to be a data worker in healthcare because we can really change the world through all of the information that's available. Well, we definitely want to finish our self-service migration. So instead of using Tableau extracts for everything, we want to push everything into Exasol, open up access to more users so that they have direct access to the database. And then the next step after that, I think, will be to start to do a lot more predictive analytics, leveraging the information that we have in Exasol to produce models, embed those back into our electronic healthcare record system where practitioners can get real-time insight on what's happening in the environment right now.